Hey guys, it's Brittany, and I wanted to hop on here to make a video talking about the medications I will be taking over the next 10 to 20 days. I know everyone's protocol is different, but I thought I would go over mine. I don't want you to think that this is going to be your protocol. I don't want you to think that these are the medications you would take if you were doing IVF. This is just my personal protocol and what the doctor thinks is best suited for myself. And so I just kind of wanted to go over that since I have been talking about this whole journey and kind of explain the different medications and what they do. The reason I'm doing this is because I know how hard it is for people to understand the medications, understand how much to take. Again, I am not a doctor, so I do not want you taking what I take unless that's what the doctor tells you to take. But just so you guys have an idea of what the medication is, if this is the type of medication you will be taking, then you know how to take it. I will be doing some pop-ups over here with the medication, just like pictures of it and a little bit about it, but I will be looking down a lot, reading some notes from my doctor to explain the medication, because again, I'm not a doctor. I know how difficult IVF is in general, and I know that it's difficult to take injections and medication. I myself am not looking forward to it, but at the same time, I know it's worth it and it's gonna work. I have faith that it's gonna work, and it'll all be worth it. It definitely will be worth the wait. So I'm just gonna hop right in and go over the different medications that I am taking. I will also say some of the medications that are similar to the ones I'm taking, but I am not taking them. Also in this video, I wanted to go over pre and post egg retrieval instructions. I do have a list from my doctor that I will be going over with you. Again, everyone's protocol is different, so if you're going through this or thinking about going through IVF, these are some things that you may go through or may be told to do. So I just thought I would give you that heads up. So here we go. Okay, so we're gonna start with the medications, and I'm going to show you some of them are in my refrigerator. So when I talk about them, I'll just pop them up right here because I'm not going to go take them out and then put them back in. So starting today, my husband and I will be doing these injections. The reason I say my husband and I is because he's the one that's going to be doing the injections for me. It's a little harder for me to inject these medications. I mean, most of them will be in my stomach, but towards the end, they will be in my buttocks. I'm not looking forward to these needles, although I do have tattoos. It is different. It's not the same. I just want to make sure that they're being injected correctly and the right amount is being injected. So I just get really anxious and nervous about this because this means so much to me. So I just want my husband to help me. And I think it's a fun experience for both of us. I mean, I'm not the only one that's going through this. Anyways, I'm gonna hop right in. So for my protocol, again, everyone is different. I just want to say that as many times as I can because I don't want anyone coming back at me saying, you told me that this would work. I'm not a doctor. So my advice is to talk to your doctor if you're doing this, and obviously your protocol is different than mine, so you will get different medications, or you might get the same, but it might be different doses. I'm just going over what I am told to take. So anyways, just wanted to clarify that for the 100th time. Okay, so starting today, July 31st, we are not taking any stim or any medication injections in the morning. We are gonna start today at 6:15 p.m. That way we are on track every 12 hours. So in the morning, we will do 6:15 a.m., which I am not a morning person, as some of you already know, but some of these medications I have to take before 6:30 a.m. So we just decided that we will get up at 6 a.m., get the medication ready. By 6:15, we will do the injections, and then 12 hours later, we will do the injections at 6:15 p.m. We're gonna do Follistim. So Follistim, it's actually in my refrigerator. So this is what it looks like right here. You do have to have a pen for it. So this is what the pen looks like. Well, I mean, this is this is what the box to the pen looks like. So Follistim pen, right there is what the pen looks like. I will take it out for you just so I can show you. There are so many videos that you can watch in order to learn how to do the Follistim cycles, but this is the pen. It does come apart. There's steps. I'm not going to take it all the way out right now. These are the needles for the pen. And so I'm not going to take it out, but I will post a link right here. So it shows you how to properly do the medication. I just wanted to show you. That's what the pen looks like. So I will be taking Follistim every night at 6:15 p.m. on the dot, but then starting tomorrow we will take in the morning only Menopur, which is this. So we'll take Menopur. I will also be taking Dexamethasone by mouth. I did take Dexamethasone when we were doing our IUIs. However, this time I do take it by mouth. Last time I did have to take it vaginally. You can take it both ways, I guess. So I will take the Menopur plus the Dexamethasone and then Ganirelix. I think I said that right, Ganirelix. This is what it looks like. At least the kind that I have. And I will open that up. Probably, actually, you know what? Let me open the Menopur up first. So this is what the Menopur looks like. So it does come with Q caps. So they look like this. And the reason I have this is because I do have to mix the medication. It does come with the needles. And then if you can see closely, this is the powder. And this is the liquid. So you take 1 milliliter of the liquid, even though there's more than 1 milliliter, there's actually 2. So you take 1 milliliter of liquid in a syringe, then you take the Q cap and you put it on top of this in order to put the liquid into the powder, excuse me. Once you do that, you will roll the powder with the liquid together. You don't want to shake it because that causes bubbles. You want to roll it in your hands like this. You still can get bubbles once you take the medication out into the syringe, but then you just flick the needle, or not, you flick the syringe, not the needle. Look at me. But because I am taking 2 vials, what we do is we take 1 milliliter, like I said, you put it in the powder, you roll it, then you take the medication that's mixed together now, and then you pull it out of the syringe, or with the syringe, excuse me, and then you put it in another powder. Put that medication into the powder. So there's 2 vials of the powder with 1 milliliter of the liquid. That's just my protocol. That's what they want me to do, so that's what I will be doing. And I will make a video on how we do all of the medications. So yes, I take Menopur, the Dexamethasone, and then this is already like pre-filled, but I will open it so you can see it. Oh, so this is the Ganirelix, and it's already pre-filled. So it already has the needle and everything. That's what that looks like. So I take that every single morning, those 3 medications, Menopur, the Dexamethasone, and Ganirelix. Every night I take the Follistim. And then I will have to go in on August 4th, August 7th, August 9th, 10th, 11th, and possibly 12th. If they tell me that my body is reacting well to the medication and it's ready for trigger, then I will possibly trigger the night of the, I believe the 10th, 11th, or 12th. That way I can have my egg retrieval that following day. So once we get to the trigger portion, I do have to take Pregnil. And then this is what it looks like. This is just the medication. And there's 2 of them in there. So it's again, it's a powder and a liquid. That's the powder. I have to take this. And then my trigger shot is actually in the refrigerator. It has to be refrigerated. It's called Lupron or Looperlide. This is what it looks like right here. So these are all the these are all the needles that I need. The one Ganirelix medication is already pre-filled, but for all of the other medications, I have the needles. They are individually packaged. You can kind of see syringes there. They also come with alcohol prep pads, because that is very important. This is just another bag of that. And then what do we have here? I'm totally gonna butcher this. I think this is Cabergoline. I think that's how you say it. If I'm wrong, I will put the pronunciation right here.
Cabergoline.
And this one is actually a medication that you do have to take vaginally. It says take 1 tablet vaginally at bedtime for 8 nights, starting the night of retrieval. So I will not take this until the night they retrieve my eggs. Wonder, you know, I'm not going to be feeling my greatest. I will have to be put under for this. This is an actual surgery when you do egg retrievals. It is a quick and easy procedure, in and out within 20 minutes is what I'm told, but I will have to be put under, and I do not do well with anesthesia or coming out of anesthesia. You can ask my mom or my husband about that, or the doctors. I'm a crier. I typically cry. Last time I had to be put under was for my wisdom teeth, and I guess when I came out of anesthesia, they had to actually put me under and not just use like the laughing gas, because for one, with a surgery like that, I wanted to be just put under, and two, my wisdom teeth, some of them were not fully grown. They actually had to shave my jawbone down to get all of my wisdom tooth on the bottom right, so that was not fun. I guess when I woke up, I asked if I was pregnant, or if I had just delivered a baby, excuse me. I guess that was on my mind. It has been for the last 4 years, so I guess I was crying and I don't remember that. Before I had my tonsils taken out, and I just remember it was really bright. It was really bright. I was freezing, I was shaking, I was crying. I was younger, so they had to like go and grab my mom, which usually you're not supposed to have people in the room with you other than doctors. But they were like, I just remember hearing, go get her mom. And I just remember my mom coming in and like petting me and telling me it's okay. So anyways, pray for me. More needles and alcohol. They are different sizes, so that's I think why they're in different bags. This is Doxycycline. I will not take this yet, but eventually I will, and I'll go over that more when I have to take it. Now I'm going to go over like the different medications that I just explained and like what they do. So I will be looking down a lot, but I'll also try to look up and explain it and show you the different medications again. So starting with tonight, like I said, I'm going to start taking the Follistim, which is in the refrigerator. Again, this is what it looks like. Right here it says that Follistim and Menopur, which I will take that tomorrow morning, and that was that one again where you have to mix the two, the powder and the liquid. So both Follistim and Menopur, it says these medications are used to induce ovulation and are responsible for stimulating the growth and maturing the eggs. Side effects would be headache, water retention, and moodiness. I already have 2 of those. And then the way you administer the medication, it says all are given as a injection, typically taken for 8 to 12 days. So these type of medications, I do not have to do them in the buttocks. This will be in my stomach. So it's just, if you think about your belly button and about 1 to 2 inches to the left, right, above and below. You don't want to go too below. Just kind of think of like a circle and your belly button's in the middle. You just don't want to go too far out of that, but you just grab your belly fat and then you take the needle at a 45 to 90 degree angle, and then that's how you inject the medication slowly. I've heard that injecting it too fast can burn. So that's what you do for those 2 medications. The Pregnol. Okay, so Pregnol, this one says it is a HCG stimulant. So it stimulates the body's normal LH surge, causing the final maturing of the eggs. It is expected that ovulation will take place 36 to 40 hours after HCG. Egg retrieval will then be performed before ovulation occurs. So the side effects, occasionally lower abdominal pain, and then the way that you administer this is intramuscular for what I'm taking. If you take Ovidrel, I think that's how you say it, you can either take Ovidrel, Novarel, or Pregnol. I'm taking Pregnol, so I have to take that intramuscular, so that would be like in the buttocks. Some people also can do it in their legs. I've even seen the back of their arms. It's just easier to give you a shot in your butt. So that's what we'll do when that time comes. That will be before the egg retrieval, which I guess all of these are before the egg retrieval, but this is like right before when you are doing the trigger shot. The next one is the Looperlide or Lupron, which is the actual trigger shot. It says, if used throughout an IVF cycle, Lupron prevents the usual hormone exchange that causes follicle production and ovulation by suppressing stimulation of the ovaries. This allows gonadotropin, I think that's how you say it, to stimulate a more uniform development of multiple follicles. So on your ovaries, you want follicles of a certain size to trigger. So basically it's saying that it helps develop multiple follicles. If used as a trigger in larger quantities, Lupron causes a LH surge and ovulation. The side effects are headaches, fatigue, and hot flashes. Again, already have those. This one you can take in your belly, and then you do have to store it in the refrigerator after opening it. So right here just explains like how to get the medication ready, what needle to use, what size, and then how to administer it. That's how all the other pages are here, which is very helpful because I'm very nervous that I'm gonna make a mistake. So thank God for my husband and for my doctor and the nurses. This is so helpful. I did want to go over the pre and post egg retrieval patient instructions that they gave me. Again, everyone's different, but this is just some good information to know. So I'm just going to read it off here. This says pre and post egg retrieval patient instructions. Before your egg retrieval, it says, please have nothing to eat or drink after midnight. That's typical with most surgeries. An empty stomach decreases the rare incidence of nausea and vomiting following administration of the IV anesthesia. It does say you may brush your teeth in the morning, wear loose fitting clothing on the day of the retrieval. That's good to know. I'm sure that will be helpful because you're not going to be feeling your greatest afterwards. Do not wear any makeup or jewelry. Oof. Bless their hearts. Shoot, I'm gonna have to take my gauges out. I just thought about that. I already took my belly button ring out a while ago because my chiropractor, who also does acupuncture, he said that it could help with it. Now, I didn't get pregnant, but then again, I was also on birth control to regulate my cycle in order to get me ready for the medication. But still, I'm almost 30. Not saying that if you're over 30 and you have a belly button ring, that's bad, but I just knew that one day I was just gonna take it out and I was gonna be fine with it, and that was the day. So I already took that out. I'm gonna have to take my gauges out just for the procedure, take my rings off. I just will leave my rings here, but I will have to take my gauges because my ears actually do, after a couple hours, they start to like shrink. One day I will take those out as well. A day is not today. I still love my gauges, believe it or not, but I will not be going any bigger. Anyways, you will need someone to drive you home from the office after the egg retrieval due to the IV sedation, and we recommend that your designated caregiver remain with you for the rest of the day and evening following the egg retrieval. This is just to prevent any emergencies that might happen. Plus, I will be on medication. It does sound like they're gonna be putting me on Vicodin, which I'm not excited about because medication like that makes me, for one, obviously very loopy. Everyone's different. Also, it just messes with my stomach, so I'm not a fan of taking medication. I was, very hesitant on all these injections, but it's worth it, and that's what you have to do for IVF. It's gonna be worth it. So that's what they want you to do before your egg retrieval. After your egg retrieval, it says we recommend that you be supervised and monitored by a responsible adult up to 12 to 24 hours post anesthesia. That's typical. General complaints: you may be tired throughout the day of your procedure. You may also experience abdominal and pelvic cramping and mild discomfort. That makes sense because they are taking a needle and literally sucking eggs out of my ovaries. It says diet: please use good common sense when deciding what to eat after your surgery. If you are nauseated, consume only liquids you can see light pass through, so clear liquids, Jello basically. Activities: it says the type and amount of activity tolerated after egg retrieval will vary from person to person. You should wait at least 24 hours before performing any tasks that require your full mental abilities, such as driving a car, signing important documents. Smart. You may shower within the first 24 hours, while swimming and taking a bath is usually allowed the day following the surgery. I love my baths. I don't care about swimming, but I love my baths. So anyways, we suggest that you drive only when you have returned to a normal level of mental fitness and physical activity, usually the 1 to 2 days after the procedure. You should avoid heavy lifting, greater than 10 pounds, vigorous/high impact exercise, or pushing for 2 weeks post-retrieval. And the big one that they want you to know is sexual intercourse. Keep in mind that the ovaries will often be enlarged and that sexual intercourse may or somewhat be uncomfortable. We therefore recommend pelvic rest for 2 weeks post-retrieval. And just so you know, during the IVF injections, you cannot have sexual intercourse. Or any heavy lifting, any high intense workouts, any abdominal workouts. Basically, all they want you to do is walk. They don't want you working out. During the injections, they do not want any sexual intercourse. So basically 2 weeks before, And right here, it's also saying they recommend pelvic rest for 2 weeks post-retrieval. So it does say the ovaries will generally return to their normal size within 7 to 10 days, although they may remain enlarged for a longer period of time. They did mention that during the injections that I'm about to take, they do recommend that women take stool softeners. I know that's kind of silly, but they say that when you're taking this medication, I mean, you're literally pumping hormones and different medication into your body. So they say that your, like I just read it right here, your ovaries are going to enlarge, which can then sit on top of your bowels, which can also make it harder for you to use the restroom. So just an idea, if you are going through this, your doctor should let you know that. But if they don't, just a tip. They also said that taking Gas X helps because you will feel like very bloated and feel like you have gas. It's just discomfort. So they just want you to not be constipated basically when taking this, because a lot of these medications do constipate you. Little TMI, but hey, that's what the doctor ordered. So lastly, it does say that pain, patients who undergo an egg retrieval usually experience moderate pain and discomfort for several days that can be addressed with a mild narcotic. Again, they're going to put me on Vicodin. I don't think that's a mild narcotic, but that's what they say. Do not hesitate to take this medication. Please do not mix the prescribed medication with over-the-counter medications, alcohol, or other depressant medications. You should not drive a motor vehicle or operate dangerous equipment while using a strong pain medication. I know you guys know that. I just thought I would go over that with you. Other medications, if you were on other important medications prior to the surgery, they may be resumed within 24 hours of the procedure. I'm not on other medications, so that's good to know. Traveling, it says, as with any surgery, it is generally suggested that you do not leave the area during the 2-week post-operative period. While the actual complication rate of this procedure is minimal, it is optimal to be near your physician should difficulties arise. That makes sense. It does say if complications are to occur from the egg retrieval itself, which is less than 1% chance, they usually do so within the first 24 to 48 hours. So basically, just be safe. Don't travel for 2 weeks. And then it just has just details of when to call. If you have a fever over 100.4, taken twice, at least 4 hours apart. If the pain does not improve, there's heavy bleeding, extreme nausea and vomiting. If you have unusual lightheadedness, weakness, or fainting episodes, pain in the shoulder area, severe abdominal bloating, you are going to have some bloating. I just want to make that clear. But if it's like very severe, you know your body. Everybody knows their own body. So if it's very severe, that's when you need to call your physician. Weight gain of 5 pounds in a single day or 10 pounds of total weight loss. Problems with pain medications. And then it says, remember to call us with any specific problem. However, if you are having a true medical emergency, call 911. So yeah, that is the pre and post egg retrieval patient instructions. I'm sure most places have something similar. So yeah, I just wanted to go over the different medications I'm taking, kind of explain what they are, how they work. When we take our first injection tonight, I will be recording all of it so you can see how it's done. This is very exciting, very anxious for me. You get to see my not so tiny hot girl summer belly. I will say these medications, not these injections, but the medications I've been on for the last, 6 months have made me gain some weight. It has lowered some confidence. Thank God I have an amazing husband to boost my confidence back up, but it's hard. It's really hard for some women, especially when you're not used to that. So just know that it's all worth it. I just have to keep telling myself that every day. It's all worth it. The weight gain, the mood swings, the depression episodes, the up and down roller coaster, like it's all going to be worth it. I have faith that this is going to work. And if it doesn't, then we will just continue to figure out our path. We are so blessed with so many loved ones and friends, family, coworkers. Like we are just so blessed to have amazing people surrounding us. I can't express that anymore. It's been an emotional time, but I'm very excited and you will get to see how everything goes, and I'm just going to keep updating you guys. I'm sorry if this bothers you, but I think it's very important. Mainly the reason why I'm doing this, I just want women who are going through this and their spouses, I want them to know that it's not easy, but it's worth it. I'm here for you guys, and I want you guys to know each step basically, because this is a lot. I'm here for you. And if you have any questions, feel free to shoot me a DM on Facebook. But yeah, I'm here for you guys. I am now gonna go put all my medication back where I had it, over it behind me. Get ready for this evening, and I will make a video later. And just want to say I love you guys, and we will keep you guys updated. Okay guys, so this is it. We are going to show you how to do the injection for the follistim. I don't know if I can turn this around, so I guess I'll just have to do this. So Jordan's getting the pen ready. Explain what you're doing.
Cleaning the top.
So that's the medication, that's the follistim. And then you need to clean the pen. Unscrew the pen. Put the medication in there. Push it in. Okay. So you see that? Nope, I didn't get it. See that arrow? It should be clicked like that. Okay. And then this is where he is going to put the needle, or attach the needle very carefully. That's the needle in the cap. So you twist it. And then there's that. And then when we're ready, he'll take that off, or he took it off now.
See the drop?
There's a drop, but he needs to dial it in you need to dial it in first, Jordan.
I know, but I'm just making sure that there's no bubbles. We do not want to inject you with bubbles. We've got drips.
Okay.
So.
And then he needs to
go to
225. If you go over, you have to go all the way out, and then it'll go back. But he did it perfectly. So now I am going to move the phone. Woo! Not looking forward to this. I am going to remove this patch, numbing patch. I don't even know if it really did anything. We are going to clean me up. It needs to be remembered about 1 to 2 inches from the belly button.
You ready?
Oh God. And 45 to 90 degree angle. Try to get, okay.
You ready? Don't look. 1, 2, 3.
Slow.
And
yeah, that's fine.
You want this? And you're done.
Okay, so the patch did like numb me a little bit. I did feel it a little bit, but
good. How many did you have?
Okay.
Is we need to put this thing back.
I don't even know where it was. That's a good thing. Jordan's a great doctor. So this is how you put it back.
I think you just push it in
Yes,
here.
so you push it in and then you twist again.
But then I untwist
Yes.
from here. Yep.
Untwist. That's how you remove the needle. I will discard it. Again. Okay, so we took the needle out. I'm not bleeding, so I'm going to take that off. And so now...
So we still have a lot extra medicine. So we could probably do another injection with this.
Tomorrow?
Yep, tomorrow night.
Okay.
So I'm going to clean this here and make sure with the new alcohol, make sure everything's clean and sanitized before we put it
And then
in.
Jordan will put it back in that little packet right there. We'll put that in the fridge because the medicine needs to stay refrigerated. And then the needle, they didn't give me a hazard needle container. I don't know what it's called. So what you can do is I have an empty litter container. Oh, I guess there's a little litter in there still, but that's okay because that's where the needle's going. So you just drop it in. You can also use a laundry detergent container or maybe like a Lysol or Clorox wipe container. So you just drop it in there and then everything is good. And that was our first injection. So super exciting. We're gonna have a baby. Okay, so how do I feel after my first injection?
Follistim 600. The medicine's not in it.
He's still talking. So I feel great after my first injection. I don't know if it has to do with the lidocaine patch that I had on my stomach, but I'm shaking. I'm pretty used to giving blood and whatnot, and I do have tattoos, which again is different, but I feel like that went really well, and I'm super excited. I thought I was gonna cry. I thought it was gonna hurt. I might still cry. Hey guys, it's early. It's 6:15 almost in the morning. Jordan and I are going to show you how we mix up the Menopur medication that I will be taking each morning. I also have to take dexamethasone orally, and then we also have to take ganirelix, which is this. So that one's already pre-filled and made. So this is how we make the Menopur. So Jordan already took off those caps over there. It looks like 2 orange ones and then a gray one, or maybe it's peach. And then you have to use an alcohol swab and wipe those.
It's Dr. Jordan.
Oh, Dr. Jordan, I'm sorry. And he's taking this big needle.
Look at this one.
Here. Yikes. That one does not go in me though, thank goodness. This one will. I guess it's kind of hard to see. That is a Q-cap.
The Q-cap to mix the medication.
Or I guess to mix it, yes.
Yeah. Oops.
That's the Q-cap. You'll see it better when he puts it on the syringe. Or on the medication, I'm sorry. So it literally just pops off. Sorry, don't mind my messy craft room cutting board or cutting mat. Okay. He pulled that back to 1 milliliter for air. He attaches the needle to the 3 milliliter syringe. He draws back that 1 milliliter of air. He pushes the air into the bottle. There we go.
Okay.
And he has to draw back the medication. Sorry, I'm not even getting that.
I'll make sure I'm right at 1 milliliter. Alright.
Okay. So then he untwists the syringe. There's 2 milliliters in that solution.
No, I actually, sorry. I have to get the Q-cap off.
Yes.
Sorry guys, first time.
That's okay. We're all learning. Okay, took us a second to get that cap off, but that's okay. So the Q-cap is on. You can see the syringe with the solution in it. He's now putting it into the Menopur powder, and then you have to slowly put the solution in the powder. You can kind of see it dripping in there. Okay, so this is a very important part. Jordan's going to take the cap off again. And what he's doing right now is he's twisting the bottle kind of like that.
And it dissolved. It looked like this before. It had the white powder in it. Now it's clear.
And so, again, you do not want to shake this because it causes bubbles, which can hurt, basically, when you inject yourself. So Jordan will flick the syringe and needle when it's time to inject myself. But that is clear. So then he pulls the medication out. That's the solution with the Menopur powder. So
All of it that I can.
Mm-hmm.
Got it?
Okay. Those puppies are hard.
Okay.
So now the medication's in that, and he is going to then put that medication into another vial of the Menopur powder, because my protocol, it calls for 2 vials. Some may only use 1. Maybe some use more, but I use 2. Now he shakes it, or doesn't shake it. Now he twists it. Okay, so Jordan just put that medication into the other Menopur powder. He has to take that Q-cap off. You can put it right there. Okay. I will hold the medication. Right now Jordan is getting the needle ready. A much smaller needle, thank goodness. Okay, and that one is ready to go. He has to flick it if there's any bubbles. Is there a bubble?
Yeah, there is, but...
Oh, yep, it's going to the top.
No, there's one at the bottom. See it?
Mm-hmm. Kind of see that bubble?
There
we go.
Alright.
And then you gotta make sure a little bit of medication comes out.
Got all the bubbles, and now I'm gonna
Just a
do
tiny
this.
little drop. There we go.
Got
And we're ready. Okay, so good morning. No makeup. Gonna take the, oh goodness. Hopefully that, I guess It's not too
right
bad.
Small red.
We thought we were gonna have to use the large needles, so definitely wanted to use that. I feel that one slow.
I'm going very slow.
Oh God.
Okay.
That one did not feel good. Oh. Oh, that one did not feel good, guys. That medication did not feel good. Ooh. Then Jordan's gotta give me another shot. So keep this one. Sorry, you guys have to see my big
Here,
old
I'm
belly.
gonna throw it away. The
needle part away, yes, absolutely. We'll put it on our sharps container. Put the lid back on. We are keeping the syringes, not the needles, because hopefully we get pregnant and we can take a really cute picture with it. I have to get the same. Okay, Ganirelix time. Same side, different spot. Try to do like
your hand, look up. I went like right here, so I'm gonna go a little higher.
Tad bit.
Okay.
Oh.
Good.
Yeah, that Menopur had to be what was hurting me, because this one's not hurting me. The needles don't hurt.
There you go.
Perfect. All right, we did it. That is how you do the Menopur, the Ganirelix, and I just took the Dexamethasone orally. So, good morning. Oh my God. Gray hair alert. Jeez. Ouch. Hit my kneecap. Love that for me. I love these bloopers that I get every time I make a video. And that's as good as it's gonna get. Gonadotropin. What? That's gonna be a blooper.